But I do appreciate everybody. Thank you guys for being willing to do this. And you know, look, I just want to jump in and even before others start coming on, and just thank you in particular from a selfish lens, and that is the need and desire from me to hear from you on the ground about the unique conditions and challenges you face, not only at the moment, but will face as we begin the process of moving into what we referred to today as phase two, where we begin to move and adjust our stay-at-home order, to modify it, and to expand the opportunities for people to get back to work with modifications, with adaptations. And, you know, it's one thing to say that, and it's another to do it. And, you know, while I have just a little bit of my background, some experience in the private sector, starting restaurants and hotels and some wineries, I have a sense of what those businesses need to reopen, but I don't necessarily have a sense of the businesses you're in and the unique characteristics, conditions, challenges. So I can only imagine the frustration when you hear from somebody like us, from me, mayors, health directors, where we say, hey, you can open up with 25% capacity. You probably sit there rolling your eyes saying, these guys just don't have a clue how our business runs, how it operates and it's managed. And so the answer, you know, I imagine that frustration is very real and palpable, and we just wanted to acknowledge it, but B, take advantage of your experience, your unique conditions and circumstances, and learn from you, so that when we put together the guidance, particularly Sonia Angel, that's why I'm glad she's on the line. She is the tip of the spear. She actually writes the guidance for the state of California and helps to advise and gets influenced by the 58 county health directors. They will be determinative in this process, and we want to make sure your voice is part of the process of application implementation. So just, again, deep gratitude. And I want to also substantively thank Tom Steyer and Ann O'Leary, co-chairs of this Economic Recovery Task Force, and their partner, Sonia the Gap, who's also part of that broader task force, for helping bring in your ideas and recommendations into that broader group. So again, they can, sector by sector, begin to break things down and do justice. But, you know, there's no prescribed agenda here. And that's why I want all of you guys to really feel free to jump in. Let's try to have a two-way conversation, but more importantly, I really, for me, it's a listening opportunity. And I just want to get a sense, maybe just Justin, I'll start with you, just because you're right in front of me on the screen. You know, I know you work in at Patagonia, and it's a perfect example. You know, what if you were to reopen, what the hell does it look like? You know, how do you even manage it? How do you get your employees back? Tell us a little bit about what you've gone through and how you see things working in the future.
Yeah, I think there's a bunch of different things we have to look at. And I know, you know, luckily my company is always going to put people over profit, which is great. But I think it's going to have to be a non-traditional open. We're still a few months away from being customer facing, even if that's something that comes up in the next couple of weeks. So I know the rollout that we're trying to look at and brainstorm would be just kicking off at the beginning with running as many warehouses. So supplementing our warehouse that's out of state. We always have the fear that if there is virus inside the warehouse, we're gonna have to lean on retail for shipping. So that would sort of be phase one. Then how do we go from that point to like buy online, pick up in store, like curbside? Do we do shopping by appointment? So we're looking at all of those things, but first and foremost would be to go off as a mini warehouse and sort of provide social distancing and like correct PPE for my employees inside the store. I know that's not going to be something every store can do because of space. In a store like mine, we do have a decent open floor plan that's, you know, we can get to that.
So you can accommodate, just out of curiosity, Justin, I mean, your ability to bring back your employees, you're able to do that, you think, on pretty short order?
Once we do get back in, I mean, there's a lot of things we have to look at. A lot of my employees take public transportation. And is it going to be beneficial for those people to jump on public transportation and come in? I have some people that are ready to go now. I have some people that are caring for elderly family members that won't be able to. And then as far as volume, I know that you mentioned on your press conference today, like there's going to be demand driven by the consumers. And, I've got 25 employees that right now are not working. Even if I come back as a mini warehouse, I'm not going to have the demand for all of those to come back. So that's something I'm trying to weigh out right now.
I appreciate it. Mario, interestingly, you were working down at Santana Row, so you were kind of in a mall.
Yeah.
And then tell us a little bit about your background and what happened to you recently and where you see yourself going moment.
Sure. So I work at a retail store, an optical retail store, at a mall, like you said, in San Jose. And we actually were, the CEOs actually made an executive decision right before the shelter in place got put in place, to close all the stores because there is, I believe, a customer in another state that got infected, and she let the company know, like, okay, well, we're just going to close all the stores now, because the store and just like the way our retail stores are, it's very close quarters. We're very close to like the people around us, and we're within like a foot of each other at all times. And so they made a decision to close the stores on March 14th. And so since then, when they told us that, they were like, we're still going to pay you the hours you were scheduled. And then from there, they assumed we would be back by March 28th. But of course, everything kept getting extended, which is fine. I mean, I definitely was not quite ready to go back yet, just with like the state of things and how like rapidly everything was going. And so they lessened hours, but we were still getting paid for those hours. And then about like a week or two ago, they made the decision to furlough all the retail and customer experience or customer service workers, with the intention to hopefully come back by, I believe, like the first week of June. And so right before getting furloughed, I was like, I made the decision just to apply for unemployment. Then that process it's kind of easy, but I definitely probably just needed, as like a first time person filing for unemployment, I think I just probably needed more clarification on like certain things. But I was lucky enough to have like friends who either know people who have done it or they've done it themselves. So it was nice to kind of have that. And then I actually got my EDD debit card yesterday. So
Nice.
It's all kind of worked out.
And Julie Sue, who's on the line. She wipes her brow. Let me ask you just, Mario, it's interesting, just the experience of being a foot next to each other. I mean,
Yeah.
if you did come back and they did reopen, is it even possible to, I mean, what's your sense of your ability to even come back in the same?
I feel like just from a customer standpoint, I feel like people are probably more hesitant to come in, just because there are certain things we do in store that like we kind of need to be close to like take measurements or like do certain things. So I feel like people would probably just be more hesitant to come in. They wouldn't really, I think from the company, it's probably be more about like building trust back into like the customer and like the company's relationship. But I think, yeah, it'll be a very interesting dynamic to have to come back after everything that's happened.
Interesting. And Myrick, you're in Fresno.
Yes.
Yeah, I mean, tell me, you've got an interesting company, interesting background. You've been able to sort of patch a few things together at the moment, but tell us a little bit about the journey you've been through in the last few weeks.
Yeah, it's been tough. You know, we went through a period of time where my employees, we had a little bit of work because we're doing some signs and bags for the census. And, but some of my employees had babysitting issues and just the fear of having their kids go to different places. And I was in fear of their kids going to different places and maybe come back and affect us. So, we're in the heart of West Fresno, which even before this happened, we had like a 22% unemployment rate. So our business is based around doing signs, banners, T-shirts, things that require large gatherings. So we're a little bit scared because, you know, once things open back up, you know, football games, basketball games, soccer games, things that was probably 60% of our business is, you know, it's a lot of uncertainties. So what we're trying to do is we're a union print shop. So we're trying to rely heavily on those relationships as far as with workwear and different things like that that we might provide. And we have been proactive because we're in a minority community that is a little slow on believing the message. So we've been taking it upon ourselves to create banners and signs throughout our community,
Nice.
just letting people know that this is real. So we even sent a couple of proposals to our local council person and City of Fresno, and we haven't heard back yet, but you know, we're still working on that. So we're just really just trying to restructure and reframe, you know, our business, because I don't know if it's a good chance we're going to close down this retail component where people can walk in, because we just don't know. I mean, you know, you know, definitely are afraid. So we have the capabilities to send things out. We have capabilities to produce products wholesale and retail as well. So maybe with the retail, we'll start relying on different places where we can go to sell our products direct to consumers.
And is Mark, I mean, were you able to get any loans? Were you able to, this PPP program, the SBA, there's the economic injury grants, and there's also these other disaster assistance grants, any of those things?
You know, with all due respect, it's kind of like the United States lottery. So it's, we applied for it and we're in the queue. So we just have to deal with what's in front of us. I think one of the things, you know, if I can suggest, you know, we received some money from Access Capital Plus, which is some of the TAP and the CIP and the TAEP. So right now at this particular point, each month we have to ask them for maybe a furlough or give us a little bit more time. So we were hoping that if something that we could do to maybe get 4 months where we don't have to really, hey, each month, hey, we're not open yet. Can you give us a little more time? I believe because these funds, you know, come from you and the state, you know, that maybe it could be some type of uniform structure to give us anywhere from 4 to 6 months that we can restructure our business to go back and start paying these loans. As you see, you know, we have one right here. It's $1,800. That's actually due May 1st. So the economy is not open, and these are certain things that we have to deal with. So receiving any money, I haven't received any money, but our biggest thing is to call our creditors and say, hey, you know, this is a situation, can you give us more time?
And has that gone fairly well with the creditors? Are they understanding, or are you getting squeezed because they're squeezed on the other end?
Yeah, we understand, you know, with our landlord, we're paying those. We were expanding next door, that we were helping to bring local nonprofits together, and this way we can kind of advocate for the community. That building I had to let go. I had to focus on the for-profit business. And so as far as with the banks and some of those, I would say 50, 60% of them have been understanding.
Good to hear. Hey, Jim, you're out there in Mendocino. You've got what? You got a lot of employees. You got a bunch of different locations. I imagine consequence, a lot of different perspectives. How are you doing?
Yeah, you know, I think hearing Marek and Judson, we've been essential. So we've been open through this whole process, but it's been a really challenge because as a small business, especially where, you know, I've been doing this for almost 40 years, this is by far the biggest challenge we've ever experienced in my, that I can certainly remember. But I think one of the things that we said was very important when we started out, we said, number one, we're going to be open. We're essential. We're feeding pets and horses and livestock and the like. So like a grocery store, except we're for the four-legged versions versus the humans. So from day one, my staff is out there on the front line, and we set some criteria. First, we said, number one, you got to take care of yourself as our humans. How old are you? Are you able to work? Do you want to work? So take care of yourself. Number two, it became take care of your family. So this is a message we were putting out, becomes you have to go home to a daughter that maybe has a lung problem, like one of our employees, or what's your daycare situation? So how do you take care of your family? Number three became take care of your customer. We need to take care of our company, because if we're not profitable, if we're not able to run and sell, we can't stay open. And then finally, it was take care of our community and our customers. So we've got it's a four-legged stool versus a three-legged stool, but none of them work without kind of that context. What that allowed us to do was basically have those one-on-one conversations with our team. How can we adjust? And I'll tell you, we've revised how can we function over the last 5 weeks at least a dozen times. And I'm pretty proud to say we've been kind of out in front of the orders, because oftentimes as an entrepreneur, we have to be thinking about the safety of my team. They're my extended family. Some of those people have been working with me for almost that whole 40 years. In fact, one employee's been there for that long. So how do we protect them in this environment? So plexiglass shields, face masks in our team, social distancing, sanitization of the actual shopping carts. This wasn't driven by a government regulation or somebody saying, here's what to do. It was really us deciding, back to that 4 criteria, how do we take care of my team? And how do I put them in harm's way every single day? And I'll tell you, the fear is real. And the hardest thing to comprehend is from your staff's perspective of understanding each one reacts to it differently. We have some members that say, it's not real, it's a myth, blah, blah, blah. We have others who are truly fearful in coming to work. One of the other criteria that we have is we have 5 locations. So we told our store managers, this is your call. I'm not going to dictate, nor could I ever dictate to you how to be open in this environment. Because if you're going to, and you need to be touching bases with every staff member. Half of our team left in Petaluma because they were over 65 years old. So now how do we stay open? We change that in through the process. And I think the message that I really would like to leave in the advice is, let us be entrepreneurial. Let us, within the guidelines, make those guidelines as broad as you can and hold us accountable for, we're talking right now, our team is socially distanced, we're masked, we're sanitized. Our organization is protecting the community. And we know we've been ahead of every single directive, because that's been my primary job, is how do I protect my team? How to protect my extended family of my organization. So I think it's very difficult. I couldn't imagine trying to write a regulation around trying to open all these individual businesses unless you can keep it very broad. And then the accountability in today's world with social media, we have a grocery store operating in town that's not sanitizing their carts. They're getting hammered within this. Yet we're oftentimes being praised at having the cleanest store and the safest operation in the community. But I think as governmental agencies, if you remember, the market will drive behavior. And so you don't have to be so concerned with prescription. I think even whether it becomes I could imagine some hairdresser working and being a local up because they're being able to deal with the issues, and others not being able to. So that's the method I would serve, is how to do it, and how to allow. The other key issue for me is I have a store in Sonoma County, one in Mendocino, one in Lake. Each one of those counties has a different challenge and a different, some have social spread, some don't. Some have community spread, some don't. So we're often dealing with those stores, and it's up to my manager really to set the tone. And then it's a challenge of keeping morale. How do I talk to my team every day, and how do I get them to put on that mask and to go stand in front of sometimes a hospital the primary emphasis is. You know, I've got an 82-year-old father who lives in town. I have my daughter and my grandchild that live in town. And so taking care of my community is first and foremost to my heart. And as a small independently owned business, you know, you are part of that community. You are a leader in that community, especially in our small town of Ukiah with 15,000. It's a big deal. So that's my perspective on it. That's how we've done it. You know, we're struggling with, should we be advertising? Should we even be asking people to come in our store at this point? Or am I putting my staff at risk by doing so? So there's tons of challenges. There's tons of ethical considerations. But what has saved me through all this process is going back to my original thing. Number one, I'm looking each employee in the eye and asking my store manager, say, are you taking care of yourself? Are you okay? How's your income? What can we do? How's your family? Is this affecting them? Here's what we need in the company. And finally, here's how we address our community. So like almost the things you've laid out, your 4 areas of opening up this economy, I think provide some guidelines or some structure to kind of work within. And that's helped us tremendously of having that basic structure for our small little company. We can't rely on I can't rely on somebody to tell me what to do. We're building that from the ground up. But I'll tell you, we're making the big chain stores, and we're making the other retailers in our market catch up to us, because this is about me, this is about my family, this is about my people, and about my community. And you got to free up the entrepreneurs to let them be entrepreneurs and let them respond to this. And I think you'll be surprised.
I appreciate that, Jim. And I hope Dr. Angel is taking notes in terms of just that framework of flexibility and that entrepreneurial spirit and social persuasion and pressures, all those. Anyway, thank you. That was very insightful.
Sure.
Sonia, who's got a small retail company with, I think, 130 employees, or maybe 130,000. Sonia, give me a sense of what the gap's starting to consider and how things are looking. And you've got a global perspective, obviously, Sonia, not just a national perspective and a statewide perspective.
Thank you, Governor. And thank you for everything you're doing to keep California safe. And all the stories we're hearing today make up the stories of all of our employees within Gap Inc. And, you know, we're, as Governor Newsom said, we're 135,000 strong, about 20,000 in California, and we're in every community. So it is a story of town by town, community by community for our 300 stores. And, you know, we used to see 125,000 customers every single day in our California stores. And it's interesting, what we're seeing is our employees and our customers are anxious to get back to normal and get back to we know it's not going to be normal, but some semblance of re-engagement. And so, you know, our journey through this is we want to work with you and with the government to be the gold standard for what safe retail looks like. And that is what we're doing with Tom Steyer and Anne and the rest of the coalition. And we can learn from our business in China, you know, and what I can share with you all is we have upward of 250 stores in China that have now all successfully reopened, and we've reopened with great safety protocols that we've built. And that's a foundation for us around what safe retailing looks like. And on top of that, we've been operating our distribution centers and our stores as mini distribution centers to augment those safety protocols and add to them. And finally, we've been working with all of the professionals in the coalition to develop and the retail associations across the country to develop safe retailing principles. So we think we can bring all that to bear and help people get through this cycle, as Jim artfully said, around, you know, this fear for your employees and for your customers. There is a way out the other side, and we've seen it in China. We're seeing good business there, good business recovery, and customers and employees feeling safe with these new protocols. So that's the journey we're on, and you know, we look forward to working with all of you and sharing those insights.
Yeah, Sonia, just out of curiosity, because it's fascinating. When you opened in China, what were the conditions? Just if you can think back to the first store that you were allowed to be open, what were the original guidelines? Was it just 10% of the foot? What was, give us a sense.
Right. I mean, we maintained nightly cleaning. social distancing of customers and employees, and mask wearing were the top three, as well as some plexi barriers, etc. at checkout. Now, it's a pretty light interaction relative to some of the heavier interaction industries in retail. So those have been good guidelines for us, and we've continued to refine them, and we'll continue to refine them. But we started there and built from there with good cadence. And so we continue to work with all of you to share those details, and expect that those can be a good foundation for those safety protocols. Plus, working across the retail industry, we're learning from the multi-category players that have been open and adding those insights in as well. So we feel confident that when it's safe to do so, as determined by Sonia, Angel, you and Governor, that we'll be ready and we'll be able to offer those guidelines for sharing as well.
Love it. And Judson, I'm curious, just in Patagonia as a brand, is there sort of the mothership providing you guidance as a manager and you start thinking about reopening, or are they leaving in the spirit of what Jim's saying, that entrepreneurial spirit at the unit level and allowing you to make decisions? Because obviously the local guidance for you is very different than the guidance in other parts of the country and around the state.
Yeah, it's a little of both. So I think we have a team of people that are looking at local stores and which ones are least impacted when you look at numbers of cases of the virus or how people are getting to work. So sort of the determining factor of when a store can get in is determined at the headquarter level. And then sort of once we're in, that's when we can kind of flex that little entrepreneurial muscle. I know Jim was talking about all the things he was coming up with. I'm sort of, itching to get in there and get my hands on it as well. I'm ready to solve some problems, and I know that's something that my employees are facing right now, is that feeling of sitting on the sidelines. I totally understand that an apparel store isn't essential. And it's a tough message to tell your employees that the job and career that they have chosen is not essential. So their paychecks are very essential. So it's a little mixed, but we're ready to get in there. And then for us, a lot of my employees have chosen to be with Patagonia for the environmental aspect. I know Tom mentioned the green aspects where he introduced himself. We kind of pride ourselves in being business to save our home planet, and we can't do that sitting on the sidelines. So it's like ready to get there.
It's interesting. Jim, just out of curiosity, I mean, you were able to source the PPE, the masks, without real problems, or did you have challenges?
Yeah, our masks were community made. Our masks were a function of a group of somebody we knew was making masks and, volunteered, frankly, to bring us some masks and mask our team. Every 2 hours we do a staff change where we sanitize. We have a checklist of what we're sanitizing: doorknobs, counters. They sign off on that. They turn it in. Every 2 hours that staff change happens. So it's not every day, but it's every 2 hours. We have we also do a health check with our team when they come to work. And it's not so much about, do you have a fever? It's how you feeling? What's going on? How are you today? And just today we had a staff member who just needed a day. He was having a hard day. So go home. We'll figure it out. It's hard to figure it out when half your team is working one shift and half your team is working another. And every transaction is expensive to do because we're taking it to the curb. So if you're not paying attention to each individual human being that's working for you, it's very difficult. That's been our secret of keeping some type of mission, and some type of smile on their face.
Thank you. I love that. Sonia, do you guys have temperature checks in China? Is that part of the requisite?
Yeah, we're doing some temperature checking. I also think that we are there. There's going to be a contract needed for citizens and for workers and employers, right? And citizens are going to need to do their part to make sure that me as an employer of 130,000 employees, that I can keep my employees safe. And so as citizens come in, they're going to need to commit to that, to taking their temperature, to wearing masks. And we as a people first employer will commit equally. So that is really, really important. I also want to comment on what Judson said about essential. I really believe it's time for us now to move beyond this essential, non-essential debate and focus on protocols for safe retailing. Because for Old Navy, which is one of my brands, we service underserved families. And there's 10 million kids in California today. Many of those families do not have access to internet, do not have access to credit. Babies are being born, kids are growing, and their local store is their vehicle to get access to that product. So I think that 50% of retail today in the country is open, and somehow we have to shift from letting every citizen choose what is essential to them, because it is we're all individuals, but we have to commit to safe retailing, which we're ready to do, and citizens have to commit to doing their part as contribution to society. So that's where we're headed.
I love that, Sonia, because today we talked about sort of transitioning the nomenclature to this notion of low risk and beginning to move beyond just that foundational phase one, essential, non-essential, to low risk, higher risk, and then highest risk. But speaking of highest risk, Myrick, you sort of punctuated when you brought that home, that it is in that highest risk sector that is your business, which are the big events and the concerts and the team sports and the fans and everything else. I mean, I do worry about what you said about, how you can navigate that, and how, despite your incredible entrepreneurial talents, I love the idea you're looking to, expand next door and build partnerships and capacity with nonprofits. But maybe you can just amplify a little bit when you look out at the next 6 months, and the prospects of some of those highest risk conventions and other things being the last to phase in. What do you really need from us in terms of the flexibility and support to be able to get through that?
Something maybe to be commissioned to help educate our communities in these hard to get to minority communities that's not getting the message. I think that by working with those communities, it helps us all, because if they catch it, we all can catch it. So we really have to, fine tune some of the generic messaging to fit some of the urban platforms, and we have the ability to do that. As far as, I totally understand as far as the restrictions, as far as these large gatherings. So we're doing our part by trying to create different products that we can, like I said before, sell online, direct to customers, work on those relationships as far as with city, state, county. We are a union print shop. So we're definitely going to rely heavily on those relationships. But as far as having walk-in clientele, I'm scared as hell. I mean, we have to. I don't think that we're going to be able to open our doors to just anybody. We're a small company, and like I talk to my employees all the time. Hey, how's your family? How you doing? How's everybody feeling? Did your kids go hang out at somebody else's house? We have to know, because any movement or any consequence comes back on all of us.
Love it. No, I appreciate that sentiment. And Mary, I'll just briefly, you're listening to this, it's from the biggest retailer, one of the biggest in the world, and some well-known brands, and then these amazing entrepreneurs in different parts of the state. And here you are, you're not working, you were working. What do you want to hear in terms of just from your lens as an employee? What do you need to feel confident and comfortable coming back to work?
I think for me, it will probably just be making sure that like the higher ups and like the people at headquarters understand that like at a retail level, we're the ones that are kind of like in contact with all the customers and like all the people that come in. And maybe just making sure that like our concerns are heard, and just like knowing that they're like actually concerned and actually care about like our health, which I'm sure they do. But if we were to ever go back, I think just having a clear communication of that would be good.
I love that. Tom, you're co-chairing this remarkable recovery task force, and you've got extraordinary challenge of trying to break down sector by sector all these nuances within each and every sector. And any questions you have in the group or just thoughts you have as you're processing this conversation?
Well, I do want to thank everybody for participating in this. And I do get a strong sense of everybody's commitment to living up to Governor Newsom's need to protect the safety and health of Californians. One of the questions I had, Governor, for all the different people on this is, as we move into opening and understanding that it's going to be not we're closed, we're open, that it's going to be a gradual process as the health statistics dictate. I mean, Sonia, when you look at what I looked at some of your proposals and I looked what you were doing in Hong Kong, at what level is that sustainable in terms of breaking even so that you can manage as these health statistics determine? And what does that mean in terms of the 125,000 people who were employed on, say, January 31st by the Gap, 25,000 of them in California? And in particular, what does it mean by level? So that the state can, I'm very interested to know how long we can sustain these partial steps and how it's going to impact human beings who have been your employees as we go through these the gradual process of trying to get back to a normal society as opposed to one dictated by these health concerns.
Tom, it's a great question, and it's a very insightful one, because we're all focused on surviving right now and getting people back to work and getting our customers serviced in a safe way. But we have to have sustainable, viable companies that can thrive. So how do we go from survive to thrive? And I really liked what Jim was saying around broad brush frameworks versus over specificity, because I think that's going to allow the innovation to happen to accomplish our safety goals without creating too much cumbersome structures that add costs, that add burden, that make companies therefore less sustainable. And we have to really focus on thriving so that we can continue to bring our employees back and keep them employed. Having an environment where we're only operating at 25% full strength or 50% full strength we can't live for very long that way. So we've got to be very intentional against your comments, Tom, and be innovative. But crisis is also an opportunity for us, and there are moments here where I think we're going to see great innovation and great leapfrog towards this end. And so that's the frame we have to have, I think. But we've got to create sustainable, profitable businesses for the long term that can be safe. Both are critical.
And do you have any additional thoughts or questions as we get close to our time?
Yeah, thank you, Governor. I mean, first of all, it's really, really helpful to hear what you're all going through. And I think as we listen, one of the things that becomes so evident is just the incredible commitment to public health, but also the recognition of the fear that people are experiencing, fear of your community getting sick, fear of your customers, fear of your employees getting sick. And I really appreciate, Mariella, your what you said, which is, make sure that you're thinking about us and thinking about the fact that we're at the front line. And I can hear that so much. And so I think that, as we do the work here, so honored to work with Dr. Angel and with people like Secretary Julie Su, I think, we do have at the forefront this notion of how can we reopen safely, and not only reopen, but, people like Jim and others are already open and can, in some sense, show us the way of what does it look like on best practices. I really appreciated what Jim said with regard to, listen, the market's going to let you know if you're not being safe and you're not being smart about how you treat people. And so I think that's also really critical. So I just want to say, on behalf of all of us who are, working in and out here at the government level, just a great appreciation for you sharing your insights of what you're experiencing. So thank you.
No, and all of you reminded us, we talk about being guided by health and data, but health is not just attacking COVID-19. We have the health of our communities. We have the health impacts of being socially isolated at home and all of the underlying issues that come from social isolation and behavioral health issues that begin to develop. And then there's the economic health of our communities and how that is foundational as well. So when we talk about being guided by health, we have to sort of broaden that frame. I think this is a reminder of that from a very sort of diverse group of folks. And so I'm really grateful to all of you. You didn't have to do this. Thank you for doing this. It's really helpful. And I'm so glad Dr. Angel's on the line, who's going to be responsible for drafting these guidelines. And so I really appreciate this notion of entrepreneurialism being reflected in those guidelines. And that's very helpful. And that's sort of distilling an essence of my takeaway and appreciation. Plus, if you don't have the lens of your workforce, then you're not serious about the work you're doing. And so, Marielle, thank you, but Jim as well, and Judson and Sonia, thank you for talking about your workforce, and Myrick, really thank you for putting that human face on these efforts as well. You guys are fabulous, and I'm really grateful for the time you took.
Thank you for listening and the time that you took out for us. Appreciate it.
Thank you.
My
guys.
pleasure as well.
Yeah, thank you.
Thanks.
Thank you.
Thank you, everyone.
Thank you guys.